Okay. So welcome to Back Fitness and Health. This is a really highly anticipated webinar we keep having. There's so many people with back issues. So you have two awesome people over here that's going to help you with your back fitness and health. First, we have Dr. Jen Kinder, and
Thank you.
and she's the owner of Rehab Fitness and Wellness since 2016. If you have injuries in Pacifica and you don't know what to do next, she's definitely the person you want to see. And you have myself next. I'm Chris Shaw. I'm the owner of Terranova Fitness since 2009. I've been coaching, it's probably going on 16 years now. And I love being around other smart people like Jen, and she's going to share some really awesome stuff with us right now. I'm going to give her back control. And 1 second. Click that. Perfect. Let me give you there. I'm going to make you the host there, Jen, and kind of have you take over and do your thing here.
All right, great. Thank you so much, Chris, for having me and to the Terranova Fitness community. I hope everybody's healthy and safe through the pandemic. And one of the things that I get a lot of questions about is back pain. Because of all the Zoom meetings people are having to be on, pretty much kind of locked to their computer. So there are things that we can do to help alleviate the pain that you might be having, and also to prevent any pain. So one of the big questions is how can I, alleviate pain? So a big thing is posture. Posture is so huge when it comes to the health of your spine and alleviating back pain. So I just want to kind of click over to a PowerPoint that I have here, just a little simple couple pictures to show you. All right, so this is me in clinic. This is how it is right now, masking up for me and you, and gloves, of course, so we are taking all the precautions, but it does feel good to be back in the clinic. So talk about posturing. I call this computer butt, mama butt, iPhone butt, and that's because what happens is a lot of people will posteriorly pelvic tilt when they are sitting, and this, for a long time, can actually take out your natural curve of your spine. So if you think of your spine, it's shaped like an S, and the S is, what it's doing is gravity is always on us, and so the spine is meant to have those curves to withstand that pressure from gravity. So if you take a look at this little model right here, this is just a partial model, of course, and we've got the lower part of the lumbar spine with the pelvis, and it should really be like this. When we posteriorly pelvic tilt our pelvis, which is tucking your tail between your legs, that's doing this. And what that does is it takes out the curve of your lumbar spine, and that can really place you susceptible to injuries at your discs and also at the nerves and other issues as well. But that's the main thing, because if we are stuck in posterior pelvic tilt, and then we start, we get up and we start doing movements and we always stay in posterior pelvic tilt, that can be really harmful for the back. So here, I'm in posterior pelvic tilt here, pretty much, pretty full there. I slightly stay out of it because I'm pretty aware of it, but this is horrible to be in for like even just 30 minutes, get really stiff. And so when you're doing that, what does your body automatically want to do? You want to stretch, right? And look at how, excuse my messy house, look at how, what is the body? This is just me standing up, and I had my son actually take a picture of me. So I'm like, oh my God, I need to stretch. And what you naturally go into, most people, is into extension. So here we're actually getting out of posterior pelvic tilt, and we're kind of forwarding a little bit, and then really extending the arms, extending the back, and even the head into a neutral position, trying to get back to a neutral position. So I just wanted to highlight that because if you're wondering why, it's actually a good thing. And Terranova is great about giving us these core workouts. So a couple of the ones I really like are swimmers, right? You're prone. We don't spend a lot of time prone. And prone, being face down, lets us work our back extensors and our leg extensors. We are stuck in a seated position so much, driving on the computer, on our iPhones. I call it mama butt because I treat a lot of mamas, and they're stuck in this protracted and curved spine position caring for their kids. So really getting out of that. And I also love the back extensions ones that Chris has us do. They're I can't think of the name of it, Chris. It's the total body extension one.
Yep.
And the thing about being an extension is great. However, you do need to have your core on. If we're just going into extension right away, you could actually hurt your back like that. So, yeah, just making sure that you have your core on. Let me just stop share here. Okay. So I just wanted to highlight that posturing and if you're also posterior pelvic tilting when you're standing, sometimes we're taught that is neutral pelvis. That is not neutral pelvis. So some different forms activities will say that to engage your core, you should posteriorly pelvic tilt. That's not actually true. You want to be a neutral spine and then engage your core to keep your natural curves of your spine. Totally okay to go into some posterior pelvic tilt when you're doing exercises. You just don't want to be walking around all day like that, because that's when you put pressure on your discs. Anything you want to add, Chris, to that?
Yes. I would say, if somebody has a back issue, we do spend, and it's a disproportionate amount of time on the exercise, the magic pill. And we definitely want to have you take a magic pill, but what's the fertilizer that you have? And the fertilizer is what Dr. Jen Kinner went over. It's your posture throughout the day. And a really good analogy I like is, if you leave your house in the morning and there's a small drip on your faucet, you don't think anything of it. But 8, 10, 12 hours later, there's a spill on the floor. It didn't happen in 1 hour, but that tends to happen with people's posture. It's boom, you don't feel anything. It's that slow drip that really gets you. So one side of the coin is, the exercises, but the other side of the coin, I think probably the most important one, is your daily posture. Otherwise, we're just putting strength on top of dysfunctional movement patterns. And in order to get that really permanent change, we need to do the exercises, but we need to have that good structure of good posture throughout the day.
I also wanted to bring up that it's so critical that when someone has back pain or any pain, they always will just try to look things up and just try to do them. What's really important to know is that one type of back pain is not your friend's type of back pain. So there's different types of back pain, and so you want to make sure that you're actually doing the right type of exercises, because there are some that shouldn't be an extension, and if they do some extension, we need to be very careful with that. So it's really not a one size fits all when it comes to injuries and to rehabbing them and to exercise. So just wanted to make sure to throw that in there.
Yeah, I completely agree with that. I think one of the best things to do is actually not take your friend's advice when it comes to back pain.
Exactly.
You should never take your friend's advice, even though they're well-meaning and they want to help. To reiterate what Dr. Jen Kinner said is, you might have somebody who has back pain because they have a stability deficit, or a mobility deficit, or a stability deficit, or a strength deficit, or, it gets weirder, a combination of all those things. And so what Jen mentioned as extension, it's just a fancy way of bending your back backwards. So imagine if somebody has extension pain, or that's what causes their pain. You don't want to put them in extension too much, because you're basically recreating the injury mechanism. The best way to think about this, if you have a medical condition that your friend has, and imagine they said, hey, you know what, you should take this exact medicine, exact dose, exact frequency. We know we got to talk to our doctor first, because there might be another medicine or a different frequency, things of that nature. So your friends are very well meaning, but what solved their back problem can actually make yours worse.
Exactly, very well said. Exercise is medicine.
Yeah.
Why we prescribe and give an actual dose of that, and TNF does a really good job of that, because it's individualized for everyone, which is why I send a lot of people there.
And then what other, for example, there's some people we will get that inquire about getting in shape, but they have a concern about, back injury, either getting it, they currently have it, or they've had a history of back pain in the past. How do you advise them to approach a fitness program? What are some of the things they should be looking for?
So they should really look for individualized programming. So coming into TNF, you want to, anywhere that you go, you really want them to be assessing what your signs and symptoms are, and doing some kind of like assessment testing, looking at how you rotate, what's your core like, and then prescribing from there. Really looking at what's your day structured like, what's your job, what is it in your day that seems to be maybe causing the pain, or back in your history, what seems to be causing the pain. So somebody's taking a really thorough really assessment of your signs and symptoms, and then tailoring your program to your goals too.
Yes.
So you can come in and say, oh, I want to get better, but if your goal is to hike up a mountain and they're giving you stuff to like walk 2 miles a day, that's not going to cut it. So you really want to be knowing where you're going and making sure you're making those benchmarks. One thing I wanted to add about a little kind of tip or trick about when we have low back pain and we're sitting in front of Zoom and you can't get up because you're in a meeting. A little trick of the trade is that you're sitting and so you want to posteriorly and anteriorly tilt your pelvis. So I know I just said to not be in posterior pelvic tilt. That is true. But what you want to do is create movement and fluidity within the spine while you're sitting here for like an hour on end. So right now you can just anteriorly tilt your pelvis, so like that, and then you can posteriorly tilt it and do it like 10 times. And what this mimics is you standing up and sitting back down and getting some movement and fluid within your body. So maybe I'll just go right into this, Chris, since we're moving right along. But so speaking of that fluidity, your body is contained, right? So within your body you have water, and that's what's creating the synovial fluid and the fluid within your discs. And so by movement, that actually pushes the fluid around. And this seems so cliche and people are going to roll their eyes, but drinking water is so important, especially on these Zoom calls. We're talking so much, it actually does dehydrate your body. So you want to, make sure you've got your water nearby and fill it and drink it. Setting a timer like every 30 minutes is something that I do just to make sure, because I'll get so involved that I'll forget. And then doing those posterior and anterior pelvic tilts if you can't get up, just to create that movement and decrease the stiffness. Another big thing is sleep. Another one you probably want to roll your eyes about, but this is so critical. When we're injured, or even not injured, even just to prevent injury. So the human body requires sleep, and that's to really give our cells a chance to rejuvenate and regenerate. So when we look at a fibrocartilaginous disc in the spine, it has fluid in it, and its job is, as you resist gravity all day long, this is going to get smaller. Now the only way that we can actually plump the disc back up is if you're like this, and that you're horizontal, because now gravity is pressing like this. Or if you sleep on your side, now we're letting gravity press like this and actually plump the disc back up. This also helps for your meniscus in your knee, because that's also made of fibrocartilaginous material. So that's just such a big thing, is diet and exercise, things that dehydrate your body, alcohol, caffeine. I know everyone's like, oh, my coping mechanism. But so just if you are injured, you really want to take a look at what's going into your body to help these tissues that are trying to heal. So I just want to add that in there.
Yeah, and what happens roughly at 20 to 30 minutes when you're sitting down, so you guys can have a visual of what's going on. Imagine there's a giant sponge in your core, like one of those car sponges we used, and after about 20 to 30 minutes, imagine to put your fist down and all the liquid goes out to the side in your core. And what that basically means is what Jen alluded at. Now you're at increased risk that fluid is gone, and it's called spinal creep, and it typically happens within 20 to 30 minutes. And so going into the anterior posterior tilt, or getting up and just going back to that posture Jen showed us, that's going to help reset that core.
And something, I love that you put that in there. I always love your analogies. They're so great.
Oh, thanks.
Also, what you can do is say you have Zoom meetings back to back. You could quickly, well, not too quickly, because if you've been sitting there, you're going to be stiff, but gently maybe do some swimmers, maybe do some back extensions, just to, or total body extensions, just to kind of wake the body up and get those muscles primed, is what I like to call it, and get them on again so that you can then maintain a good posture as you sit. Yeah, I wanted to just make sure to throw that in there. And breath work is a big one. So breath work, I know that Chris is, he's always talking about breath work as well. And this is generally what I start my home exercise programs for patients with is breath work. And they're always like, why? Like, this seems so worthless, but it's actually huge, because if you just take a look at how you're breathing from day to day, and if you put one hand on your belly, one hand on your chest, and you just take a deep breath in, which one rose? Did your chest rise first, or did your belly? So if you just had your shoulders rise and your chest rise, we want to actually reverse that. We want to get out of that positioning for breath, because what can happen is we only should breathe with our chest when we're doing some high intensity stuff, like running, like you're running for the bus, running from a bear. That's the autonomic nervous system of fight or flight kicking in. And when you're just sitting in your car, or when you're just sitting at a Zoom meeting, you shouldn't be like, right? You're starting to like give yourself lack of oxygen. And your brain reads that. It doesn't know that you're not running from a bear. It just says, oh, signal, stress, I'm going to send out some cortisol. I'm going to send out adrenaline. And we get really anxious. And then what happens is the muscles can get really tight. So your back muscles can get tight. It's also part of the fight or flight response. And so what you want to do is try to just breathe and belly breathe. So inhale into the hand on your belly, exhale, and just let that breath go. And just do a few of those breaths, and then what people they usually say that they feel so much more relaxed. And actually a lot of their back pain can subside just from that, because of that lack of tension that they're able to create by just breathing. So I know it sounds a little like, what, just that? But yeah, it can be just that to really help with decreasing your pain.
Yeah, and going back, touch on two things there. The software program is super important. I've been coaching people probably going on 16 years now. Anyone who I've assessed that has back pain, it's almost eerie that 90 to 95% of the people have dysfunctional breathing, literally. And then I'll ask questions. So how often do you get tension headaches? How'd you know? It's pattern recognition. And so think about the breathing pattern is your software program for your core. So if your software program is not programmed correctly, the hardware is not going to operate correctly too as well. And it's going to stress you out, and it pulls those muscles that are doing the breathing up top, it pulls them from their primary objective, which is to help the core. And so think about it, when you're spending time on your breathing, it's not just breathing, it's your software program for your core and the communication that goes on. And that's what I try to instill people, because I get the same thing. It's like breathing, it's like it's your software program. Get the software online, and then the hardware will work better, I trust. Same thing, I've had people work on breathing, and it's almost eerie how they're able to gain a little bit more control of their core.
So thinking about, so if we look at the core, here's the pelvis, right? So the pelvic floor, then your transversus abdominis muscles here, and then up above is your diaphragm. So when you inhale, your diaphragm naturally flattens, and the pressure in your belly should naturally come down and out a little bit. And as you exhale, everything should go back in, and the diaphragm comes back up. Well, when you hold your breath, or when you inhale and then you suck your belly in, it's like kind of like what we've always been taught, to suck your belly in as you're like walking on the beach or something. No, we don't want to do that. That causes that dysfunctional patterning of breath, which then causes dysfunctional neuromuscular control of your core muscles, including the muscles in the back. So multifidi, even the parts of the erector spinae. So as you inhale, imagine your diaphragm coming down, that's naturally going to happen, and then your core coming out. And then as you exhale, it should all come back together in a nice, neat canister. And so what Chris is saying, just to reiterate that, is that you're actually doing a core exercise when you're breathing. We don't want to be sucking our tummies in and all that kind of stuff. It's because that's actually inhibiting your diaphragm from moving. And that can actually cause pressure issues which can cause like other things with your organs, so prolapse, incontinence, all that kind of stuff, and just back pain stuff in general. So so glad you brought that up, Chris.
Yeah, absolutely. And we had a question about doing a hip opener exercise. What do you recommend as far as that in relation to the back pain stuff?
Yeah, so if we look at our pelvis, right, the pelvis is awesome. It's literally like the root of our core, right? So we've got all these muscles. If we look at the back, there's the glutes, right? So glutes are huge, and then your hip muscles are on the sides, including your glute med, which is on the side here. So those hip muscles are completely tied to your back. So, you know, when we look for back pain, we actually look above and below the back to see if there's any dysfunction with any other joints. And the hip is often sometimes the cause of it. So if we see a really tight hip joint or a really weak hip joint, that's a big one, then that can be feeding into the back, maybe doing too much that it shouldn't be doing. This is also where it comes to, is your issue a stability issue or a mobility issue? Sometimes people are going in and getting adjustments to their back so much, and that's actually can be contributing to more pain because they actually need stability and they're getting mobility. It's like, no. So with the hips, same thing. We have to look and see how mobile are your hips. Do you have full range of motion of your hips so that your back can move fully? I really like the one that Chris has us do where you're in like a lunge. I don't know the name of it, lunge, and you do some thoracic rotations while you're in the lunge. Like, who often ever does that throughout the day? It's like, maybe if you're doing yoga, that'd be great. But even with some yoga, if people have some back pain, you want to kind of tone it down sometimes just to like not make the movement so complex. So I like the hip openers that we do at TNF, super helpful. And also that helps create mobility in the thoracic spine. So that's a big one. So your lumbar spine can take a lot of pressure when your thoracic spine is tight. And I could pretty much 99% guarantee that our society has very tight upper T-spines because we're sitting so much and we don't rotate enough. And when we do rotate, it's like, ow, because we never rotate. So I love that TNF incorporates the whole body into movement, and because that's really the best thing you can do to prevent back pain is to keep moving. Yeah. So that's been shown that when people get hurt and the first thing they do is lay down, you're only making it worse. I mean, granted, you want to allow that acute phase to go through, but the worst thing you could do for a back is prolonged bed rest. Yeah. Again, we're making stagnant the fluid in the discs and the other tissues, the ligaments, they're full of fluid as well. So introducing small, gentle movements, starting with breath work, can really, really be helpful. You want to add something to that, Chris? Yeah,
absolutely. Two specific things is, one is the concept of the criminal versus the victim. And what I mean by that, sometimes when I get people to come in here and they have a history of back pain, I'll look at their hips. I'll look at the thoracic spine, as Jen mentioned, and they'll say, but it's my back. I was like, I know, but let's figure out who's causing this issue. So a lot of times, look, you got to want to pay attention. If you have back pain, pay attention to it. But there might be a contributing factor in your hips and thoracic spine. I'll give you, and this reiterates the point, do not trust your friends when it comes to back pain. They mean well. Do not trust the internet when it comes to your back pain. It's because this nuanced stuff is so important. Taking into account the individual is the most important thing when it comes to back pain. So you might get back pain because you have a limitation in hip flexion or extension. And so now your back is making up for the movement, and it's not designed to do that. And so really coming into an expert and figuring that stuff out, that's the one thing to talk about. The other thing, is a really good point you mentioned here, is somebody will get maybe a chiropractic adjustment, or they might be doing a stretch that they say relieves them. Not so fast. It's not a black and white issue, but here's what's happening. A lot of times when you get an adjustment or you're doing a stretch, maybe for your low back, what you're feeling is that stretch reflex. It's an immediate, but if you have a stability issue, you're just feeding into the problem. And one of the analogies I like, imagine if you have a scab and you scratch the scab. it feels good, right? You're the scratching the itch, but you're reopening up the wound and the possibility for an infection increases. So again, when you look up exercises on the internet about back pain, if you don't know the exact injury mechanism or contributing factors, you actually might be doing more harm than good. And it makes sense, right? You do this and it feels good. Like, it makes sense logically that that's a productive exercise, but we know doing drugs feels good in the moment. Drinking alcohol feels good in the moment. So many things feel good in the moment, but a lot of times if you're not making progress, it's because your back is hungover from taking medicine that it shouldn't be ingesting. So reiterate that point as far as be very careful looking stuff up, especially with the back.
Yeah, and I just want to always say that, with the webinar, I'm not diagnosing or treating anybody's back pain right now. It's just informational, educational.
Yep.
And I also want to say that I work a lot with chiropractors. We refer back and forth to one another, so it's not, speaking anything about chiropractors. It could be anything. Like, I have clients that go to massage therapists who are like pushing on their back and doing all this kind of stuff, and I'll just reach out to the massage therapist and say, hey, maybe don't do any mobilizations on the back right now. We're doing this. Let's give it 2 weeks and see if they get better. And it's no problems because we're working together. I'm all about do what makes you feel good, please, because we need that. We are not one size fits all, so we got to do what makes us feel good. One stretch, one thing that gets a major complaint and all the fault is the hip flexor. So the hip flexor, it's sometimes people are like, oh, I gotta stretch my hip flexor to help my back. Yes, but often, let's take a look. I just want to share my screen one more time. I just want to show you, looking at this picture. So what am I really, I'm stretching, but I'm also activating my glutes. So the hip flexor's in the front here, and we're stretching a little bit, and if you go into like a full lunge position and stretch hip flexor, but it gets blamed for so much that really it's not usually the hip flexor's fault. It's actually the lack of glute activation and lack of strength in the glutes. So when we're sitting like this, I'm not activating my glutes, and my hip flexors might be getting a little bit tight, but it's not like they're just going to cramp up unless you have some severe condition. But it's more that my glutes aren't getting exercised all day long as I sit on my iPhone or my computer or, carrying my baby around, holding my baby like this. So what it really is, and this is what I like when I was talking about the swimmers and the total body extensions that we do at TNF, is we're actually activating all those muscles. We're not sitting there stretching hip flexors out all day. You can stretch till the cows come home. But if you don't actually strengthen the antagonist on the other side, you won't keep that length that you're trying to gain. So it's really the fine balance of the pelvis. And so if we are constantly stretching, but it's not holding, we got to do something for it to hold. And so that's where just little simple exercises can really make a huge difference in balancing out your pelvis, keeping it neutral, and keeping you healthy.
Yeah, and again, going back to the example of all the people that I've had with back issues, I would say virtually 90 to 99% of them do not know how to fire their glutes. And let me be very, very precise. That doesn't mean they're weak.
Right.
It doesn't mean they can't lift heavy weight. It does not mean that. It means the actual software program is not functioning properly. And you'd be surprised. You will have people that have back pain, and I'll teach them how to properly screw their feet in, create that tension, activate their glutes, and they're like, it's gone. And because the glute kind of operates like a bodyguard. And if it falls asleep, it basically, if your butt's not doing the job, it's going to affect above, which is your back. And so one of the main things we teach here is we teach people first and foremost, how do you create tension in your glutes so it creates this stable position so you can push weight and heavy weight. So just because your glutes, you can be very strong, lift lots of weights, but I've seen guys come in here super strong and they can't fire their left glute as good as their right glute, and they wonder why they have back pain on the left side. It's not because they're weak. It's a timing issue. Yeah.
No, that's so exactly that. And it's not the lack of strength, it's the neuromuscular control that's really lacking. And so I love that, working on that patterning. Exactly.
And then what about core exercises? So again, we'll probably reiterate the same point. A lot of people say, I have back issues. What core exercises should I do? And again, there's no one size fits all, but what are some commonalities or things people typically are getting wrong when they try to do things on their own?
Yeah, so sometimes they don't know when they are not using their core. So they'll do one of the exercises I love is marches, for instance, because it helps you keep a neutral spine when you're laying on the floor. Of course, we want to do exercises standing up, but to kind of find your neutral position, you just lay on your back and that's where your pelvis lies, and that's your neutral position. Then you want to engage your inner core muscles, and pelvic floor is one of them, but the transversus abdominis, mainly that we're talking about right now. And that its job, if you look at an anatomy textbook, its job is to quote unquote hold the organs towards the spine. Like it's to hold the organs up and in, right? So what happens is people will do a movement, they're doing a core exercise like a plank, for instance. Now, like I don't feel it in my core, I feel it everywhere else but my core. There's an issue with the neuromuscular patterning for that transversus, or also a lack of strength. It can be both.
Yep.
So going back to marches, I really like that one because it keeps you in neutral position, and then you have gravity coming down on you to kind of help with engaging that core. We can also flip that over, and I love quadruped. Quadruped is like one of my favorites. So it's hands and knees position, because now we have gravity coming down, and then transversus has to fight it. And it seems like so minuscule, but don't underestimate gravity ever. So gravity's coming down, and transversus has to come up and in to help balance you and keep you stable. And the second you move your arm or leg, if you lose that transversus control, you know that your transversus is not primed to work when it should be, because it should be engaged when you're doing movements. Not taut and tight, like you don't want to be holding your breath ever, but it's more like, is my transversus engaged so that my back isn't doing too much of the work?
Yeah, totally agree there. The most important thing is, are you doing it correctly? And do you know how to gain control of your core? And really recognizing good and bad, because you can have the best exercise in the world, but if you're not doing it properly, if the right things aren't firing, it's now the worst exercise in the world. Yeah, and so that's so important, is when you look up exercises, having somebody to give you a watchful eye and say, okay, great exercise, this is what it should look like, this is what it should feel like, now does it? And Jen mentioned a plank. There might be several reasons why you don't feel it. It could be that you have no control, you haven't been trained to control it, it's a technique issue, or it can be that you're just not strong enough. And so having that watchful eye to tell you, educate you, the analogy is teach you how to fish so you can fish on your own. And then that's the main thing. We'll see people doing exercises, and it's, they mean well, they got great effort. I was like, okay, I'm really big on coaching is if this, then that. If you do this exercise properly, you should feel this going on. If you don't, we got to figure out what's going on. So technique. Yeah. So we're coming down on the last 2 or 3 minutes. Is there anything else? We covered breathing, we covered postures, we covered core exercises, sleep, hydration. The things that aren't the sexy, exciting stuff might be the thing where you can make the most long-term effects going on. We talked about the hip flexor, the glutes. Is there anything else that we should talk about before we sign off here?
Gosh, I think those are the main things for like general well-being of back issues, and general well-being to prevent back issues. Definitely those things can make a big difference. So yeah, keep moving.
Yes.
Another one is, so often mental health conditions can go unseen, right? And your posture, if you notice, if you've ever been very sad, depression has been linked to even back pain, right? So when we are depressed, our posture changes. We're like hiding from the world.
Yep.
We are creating a if I stood up, you can see, but creating this posterior pelvic tilt, just sort of hiding from the world. Being in that posture all day long, so even your mental health can contribute to back pain issues. And it's been shown that exercise can actually relieve depression. So, what's tied there with posture and exercising. It's so fascinating. But the mind body connection is so huge. And when we look at anxiety creates tension,
Yep.
and the upper trap tightness, and not just upper traps. That's a big sign of that, but just overall body tension. And so there's certain books I send out to patients to read for low back pain issues, because it's been shown like chronic low back pain and the mind-body connection. Dr. Sarman is the author of the book, and it's just so great. I've had people actually read that book and their back pain goes away. Haven't even touched them, haven't even seen them. I just say, read this book, as a component of our care, and it's actually helped people. So the mind-body connection shouldn't be forgotten. I think that's it's so key to overall wellness and health.
Oh yeah. Yeah, no, really good point, because the posture, the compression, when you're stressed out or depressed, you have more cortisol in your body, which increases inflammation. And so movement, so important. If you need to just get up and do anything. I think the other thing to caution people too is a lot of people, they won't start exercising because they're so concerned about their back, as they should be. I completely understand, but there's a time and a place to get over that acute injury. But if you're not moving, you're not doing something to get stronger, you can actually be causing a little bit more long-term damage, or at least it's going to take a longer for you to get rid of that pain. So go find a qualified professional, ask them questions like we did on this webinar. What about this? What about this? What about this? A skilled coach or professional, you should actually get them to please shut up, because they have so much information to give you. Especially if somebody's skilled and has a lot of experience, they should be able to wow you at least with some type of knowledge. And if they're around you within 2, 5, 10, 15 minutes, you should be able to look at them and say, okay, you're the person I need to see, because you just educated with me, you made me feel something, it's better. That's what a skilled professional can do, and they can do it pretty much quickly, more times than not. Obviously there's extreme issues. So educate yourself, but do something, even if it's having a conversation with somebody, get the ball rolling.
Thanks so much, Chris.
Awesome.
Great.
Awesome.
Super fun. I hope we get to shelter in place. Well, I hope we safely get to
Yeah.
at some point. So
I actually was on the live meeting with the board of supervisors in San Mateo County. Really fun.
oh man, that's great though, huh?
Yeah,
Hopefully.
I'm trying to keep updated as much. So we'll do another one of these shortly. Good feedback off this one, and we'll do some other things too. Back, maybe we'll do the one where, all right, you have no back pain. How do we start bulletproofing your back so you can do the things that you love with your friends and family and not worry about